So I'm excited about what we have accomplished. In 2023, we created a structure by setting up committees and assigning committee leads and co-chairs that would lead to the expansion of the work. So we have four standing committees. We have a sustainability and employment. We have an infrastructure and capacity. We have an engagement, recruitment and retention, certification, education, and curriculum. And then when we started out, we realized that we needed a legislative work group because that's a huge part of the work that we're actually doing. And then we created an employment work group to focus and to really wrap around what we were trying to do in terms of outlining the objectives. So the aim really is to look at advocacy, promoting the work of community health workers, and then, just laying out and what was laid out by the funders, because we are actually funded by the state, but the dollars come through the CDC. So making sure that we are really in adherence to what the state is asking us, and by extension, the federal government. So the primary goals in a nutshell, based on the hub design, aligns with the committee. So the first one is to reduce the duplication of efforts in order to maximize resources, because we found that happens a lot in New Jersey. Sometimes one organization doesn't know what the other one is doing, and we could ultimately partner, and COVID taught us well in that regard. Everybody came together in that space. So maximizing the resources was key. The second goal, we had to ensure that there was clear and impactful communication throughout the implementation process when we started in 2023, and we really laid a strong foundation. Then we had to leverage the essential expertise as required in order to support and sustain the success of the model that we're creating. And finally, just building the foundation for a cohesive statewide system of CHW participation in the overall care of continuum. And again, although we only have 20 plus individuals, we are growing that with the portal. The hope is to capture all of our CHWs across the state of New Jersey and to be able to engage them fully in all of the work that we're doing. And so ultimately for us, as we look to the future, seeking additional funding and potential opportunities to expand the array, the different types of organizations, one, and to grow long-term sustainability. So I think for us is really working strongly with Unite Us, promoting the work and really showing off what we have gained and the data that we have shown. Initially, we wanted to do 750 referrals. That was our game plan. We exceeded that to over 1,000 plus, right? And that keeps going. So I just, for us is to grow and to make sure that this is a permanent infrastructure within the state of New Jersey, and that community health workers are being recognized for the work that they're doing in all areas, in all facets, irrespective of, like Sydney described, it's irrespective of the title. It's about the work, and really they know the communities more than anyone else. And we have seen just from the short time that we have worked with Unite Us, the data that we are seeing and closing that gap. So ultimately, I think identifying our data, identifying the trends, looking at, collecting the data so that we can showcase that as well, and then just to reduce the health and social needs and the disparities among our population. Our time with Unite Us since 2023 has grown, both professionally and, relationally. And I believe that as we keep adding CBOs and spreading and making this will be a mainstay in the state of New Jersey, having Unite Us along with the hub, along with our partners from New Jersey Department of Health, that we will see more success, and individuals, most importantly, we'll be able to reduce the inequities and find equitable solutions for health disparity in the state of New Jersey.